Hello everybody, greetings from Chennai in India. I am going to briefly present the role of glitazones in dermatology. Physicians are constantly looking for newer and better drugs to control diabetes and its complications. One such oral anti-diabetic drug introduced in recent times is thiazolidine dione, thankfully shortened to glitazone, used in the treatment of type 2 diabetes mellitus. It interferes with the peroxisome proliferator activated receptor gamma, again shortened to PPR gamma, which stimulates gene transcription at the molecular level. At the cellular or physiological level, glitazone stimulates adipocyte differentiation, enhances insulin-sensitive glucose uptake by muscle and fat cells, suppresses angiogenesis, and normalizes keratinocyte differentiation. It also diminishes inflammatory cytokines, particularly TNF-alpha. I shall consider a few of the skin conditions where glitazones have been found to be effective. Naturally, the first disease to be targeted was psoriasis. Glitazone, TRO glitazone, was the first commercially available glitazone. It did work well until a few years ago. They reported cases with psoriasis treated with this condition developing hepatotoxicity. So in 2002, the drug was withdrawn from the market. The ones used today are pioglitazone and rosiglitazone. A large series of 70 patients was treated by Shafiq et al. With 30 milligrams per day, and they found it to be very effective. The improvement usually occurred between 6 to 8 weeks after the commencement of the drug. Hirsutism. Glitazones have been used in patients with PCOD associated with abnormal glucose tolerance and hirsutism. Direlli et al. Gave 2 to 4 milligrams of rosiglitazone for 8 months to 40 women with PCOD and diabetes, and the hirsutism improved significantly. Melanoma. PPR gamma is found both within melanoma cells as well as in the benign nevus cells. An experimental glitazone is called C-glitazone, CI-glitazone, was tried in melanoma and found to have dose-dependent inhibition of the tumor cells. Vascular tumors. PPR gamma is expressed on endothelial cells and its activation inhibits growth factor-induced proliferation. 2 patients from Germany with facial angiosarcoma, one of the horrendous destructive tumors of skin, and proglitazone given 45 milligrams per day showed good remission in these 2 patients. Endemic Kaposi sarcoma also responded with 8 weeks of glitazone. Lipodistrophy. Decrease in peripheral or subcutaneous fat can be cosmetically very disfiguring. It is especially prominent in patients with AIDS who had treatment with heart antiretroviral therapy. Recent research showed that PPR gamma is the most important transcription factor involved in adipogenesis. Arioglu et al. Tried glitazone in patients with lipodystrophy for 6 months, and they found modest and rather unpredictable improvement. Fibrosis. PPR gamma receptor is an anti-skin fibrotic driving force and hence benefits fibrosing conditions like scleroderma, which is a boon to dermatologists. Finally, cicatricial or scarring alopecia. An uncommon but prototypical scarring alopecia is lichen planopilaris, LPP. Patients present with sudden onset of hair loss with symptoms of itching, burning, and pain on the scalp. The hair loss is progressive. Many immunosuppressive therapies, both topical and systemic, have been used with minimal response in established cases. Mirmirani and Karmik, 2 Indian-American doctors working in Boston, they published in the Archives of Dermatology that in an LPP, there is decreased expression of PPR gamma receptors. Glitazone activates PPR gamma, and in a dose of 15 milligrams per day as pioglitazone, they showed that it was beneficial in LPP Though glitazones lower blood glucose by improving insulin sensitivity, circulating insulin concentration is not affected, and so it can be safely used in non-diabetic patients also. However, glitazone can cause weight gain and peripheral edema as a result of renal sodium reabsorption. Hence, care should be taken when prescribing it to patients with congestive cardiac failure. Nevertheless, glitazones have better safety profile and acceptable adverse side effects when compared to other contemporary medications that have been used in all the conditions that we have just now described. And hopefully it will add to the therapeutic armamentarium of dermatologists. Thank you.